All right, so the next muscle that we'll be doing is the iliacus. We'll be performing the AMC and S testing, the DFMAT protocols, as well as the pit contractions for the iliacus. In order to test the iliacus, we'll have the patient laying supine on the table. We're going to bring them into full active external rotation of the side that we're looking at and about 30 degrees of hip flexion. So they're going to actively bring it up to about 30 degrees. From here, I'm going to stabilize on the opposite ASIS, and I'm pushing down into extension and slight adduction as I push down, and you're going to resist when I say go. Ready, go. 1, 2. If that muscle tests weak, we'll go ahead and perform the DFMAT on the muscle. In order to find it, we're going to be palpating the iliac crest. We're going to use a cupping type movement to dive deep into the iliacus to sort of those superior fibers. We'll palpate there, and then we'll palpate inferior to the insertion onto the lesser trochanter. And once those palpations, once the DFMAT is completed, we'll go ahead and perform the pit contractions. So we'll have the patient actively externally rotate their leg as far as they can, flex their hip up to 30 degrees. I'm going to take the pressure of the leg. They're going to simply lift their leg off my hand. Go ahead and lift up for 6, 4, 5, 6, and relax. We will perform 6 of those picks on each affected side. The next muscle that we are going to be assessing is the rectus femoris. In this case, it will be the straight head of the rectus femoris. In order to perform the AMC and S testing, we'll have the patient laying supine on the table. We're going to keep their hip in a neutral position, and then we're going to have them actively flex their hip to 30 degrees. And in order to test, we're going to be pushing straight down into hip extension. When I say go, push back, ready, go. 1, 2. If that muscle tests weak, we'll go ahead and perform the DFMAT protocol. So we'll palpate first the anterior superior iliac spine, and then we'll just go distal and slightly medial to that to approximately the AIIS, the starting point of the rectus femoris. We'll perform our palpations there, and then once we've completed that, we'll go to the insertion point, which is the patellar tendon and ultimately the tibial tuberosity. So I'm going to simultaneously palpate the fibers proximal to the patella and down into the tibial tuberosity. From there, we'll go ahead and perform our pit contractions. So we'll have the patient actively flex their hip to 30 degrees, keeping that neutral pelvis. And I'm going to support you right here. I just want you to lift your hand up, or your leg off with my hand, for 6, 2, 3, 4, 5, 6. We'll perform 6 contractions for 6 seconds on each affected side. All right, so next we'll be performing the protocols for the reflected head of the rectus femoris. So to check and test this part of the muscle, we'll have the patient laying supine on the table. They're going to actively internally rotate the femur as far as they can, and then actively bring their hip into about 30 degrees of flexion. So from here, we're going to be performing a movement of straight down into hip extension. So we'll stabilize, and I'm going to be pushing straight down. Ready, hold, 1, 2. And if that muscle tests weak, we'll go ahead and perform our DFMAT, which is similar to the straight head fibers. We're going to first palpate the ASIS, go a little distal and slightly medial onto the AIIS, perform our palpations on the origin of the muscle. And once we're done there, we're going to slide down distal to the insertion point. So we'll cup the patella to palpate the proximal fibers above the patella, as well as the patellar tendon down where it inserts onto the tibial tuberosity. Once we've performed our palpations down there, we'll perform our pit contractions. So we'll fully internally rotate the femur, actively flex to 30 degrees, And keeping that full internal rotation, just lift your leg up off my hand for 1, 2, 3, 4, 5, 6. And we'll perform 6 contractions at 6 seconds on each affected side. All right, next we'll be assessing the anterior fibers of the tensor fasciae latae. So what we'll do is we'll have the patient laying supine on the table. We're going to actively abduct their hip about 20 degrees and then actively flex their hip 30 degrees with full internal rotation of the femur. Once we're in position, we're going to cut the calcaneus and we're going to be pushing straight down into extension through our vector. And so when I say go, push in, ready, go. 1, 2. If we notice weakness there, we're going to go ahead and perform our defemat. So the proximal fibers, we're going to palpate the anterior portion of the lateral tip of the iliac crest. And we'll just go just distal to that and palpate right at that origin. And once we perform that, we'll slide to the distal insertion, which is essentially the insertion onto the tibial tubercle where the IT band inserts. And we'll palpate down there. That's between the femoral head and the tibial tuberosity. And then we'll go ahead and perform our pit contractions, abduct 20, internally rotate as far as we can, flex that hip up to 30 degrees, and you're just giving me 10%. Ready, go. 1, 2, 3, 4, 5, 6. We'll perform 6 of the pit contractions on each affected side. Next, we'll be doing the lateral fibers of the tensor fasciae latae. Again, the patient remains in the supine position. This time we're going into about 20 degrees of hip abduction, full internal rotation again, and flexing the hip up to actively flexing the hip up to 30 degrees. This time, instead of coming straight down into extension, I'm going to be coming down into extension and slight adduction through that oblique angle. So when I say go, hold, ready, go. 1, 2. If that muscle tests weak, we'll go ahead and perform our defemat. So we will palpate the anterior or the origin of the muscle. So we'll find that the anterior part of the iliac crest will come just a little, posterior and slightly distal to that, to those lateral fibers of the TFL, and we'll palpate there. And then we'll slide down halfway between tibial tuberosity and the femoral head on the tibial tubercle and palpate those fibers. We'll then perform our pit contraction. So we'll have the patient abduct 20, fully internally rotate, flex 30 degrees, hold that right there. I'm going to push down and in. Don't let me. 10%, ready, go. 2, 3, 4, 5, 6. We'll perform 6 of those picks on each affected side. All right, so the next muscle we will be assessing is the sartorius muscle. So in order to assess this muscle, we will have the patient go into an active, flexed, abducted, and externally rotated position. So I'll let their external rotation sort of fall wherever that is, and that's the angle that I will be performing my resistance from. Once they're in this flex, abducted, externally rotated position, I'm going to stabilize the opposite knee. I will be holding down at the lower distal part of the lower leg, and I will be trying to actively extend the knee while they resist. Resist on the count of 2. 1, 2, go. 1, 2, hold. Good. Once I have checked that, and if it has tested weak, I will go ahead and palpate, do my defemat procedure. And so we'll palpate the anterior superior iliac spine. Once we find that anterior superior iliac spine, I will palpate those origin fibers. Once I palpated those, I will go distal and to the insertion point, which is the pes anserine. So we'll palpate the medial aspect of the knee, go slightly inferior into that pes anserine. A common insertion point, we'll palpate those fibers. To perform our pit contractions, we'll have the patient go back into the flexed, abducted, externally rotated position. So I'm going to pull out, you're going to give me 10%. Ready, pull. 1, 2, 3, 4, 5, 6. We'll perform 6 of those on each affected side. All right, the next muscle we will be performing our testing on is the piriformis muscle. So in order to test this muscle, we'll have the patient laying prone on the table. We're going to have them actively abduct about 10 degrees. They're going to bring themselves into 90 degrees of knee flexion, and we're going to go into full external rotation of the femur. I'm going to stabilize up around the lumbosacral area to make sure they're not lifting up off the table. And when I say go, I'm going to try to pull them into internal rotation as they resist. Ready, go, hold, 1, 2. If we notice any weakness there, we'll go ahead and perform our DFMAT. So we'll palpate the anterior portion of the sacrum. So we'll come down right into those fibers where they originate on the sacrum. And once we've performed our palpations there, we'll slide lateral and palpate the greater trochanter, specifically the superior border of the greater trochanter. Once we've performed our DFMAT, we'll go ahead and do our pit contractions. We'll keep that abducted, that 10 degrees abduction, 90 degrees of hip flexion, full internal or full external rotation of the hip, and just give me 10% for 6-second hold. Ready, go. 1, 2, 3, 4, 5, 6. We'll perform 6 of those on each affected side. All right, so the next muscle we will be assessing is the quadratus femoris. In order to test this muscle, we'll have the patient laying supine on the table. We're going to bring them into about 75 degrees of hip flexion. So once they're in that hip flexed position, we're going to go into full external rotation of the femur, and then we're going to bring them down so their tibia is parallel with the table. From this position, I'm going to be stabilizing the knee, so they're not having to fight that. I'm going to cup the heel, and my action is going to be pulling them into extension while also trying to internally rotate, and they're going to resist. Ready, go. 1, 2. If that muscle test's weak, we'll go ahead and perform our DFMAT. So we'll have the patient then turn onto their stomach. I'm going to be showing them on the left leg, even though the right leg was the side that I checked, just for video purposes. So what we'll do is we'll palpate the origin first, which is the ischial tuberosity. So we'll palpate that sit bone, and we're going to come just superior on that superior lateral border of the ischial tuberosity. We'll palpate those fibers down there. Once we palpated them, we'll palpate the greater trochanter. In this case, the intertrochanteric crest, so sort of in between the greater and lesser trochanter of the femur. And we'll palpate those fibers where the quadratus femoris is inserting. Once we've done that, we'll have them flip back on their backs in the supine position. Flex hips 75 degrees, full external rotation, tibia parallel, and I'm going to be pulling you into internal rotation and out as you resist. Are you ready? And hold for 10% contraction. 2, 3, 4, 5, 6. We'll perform 6 of those on each affected side. All right, the next muscle we'll be assessing is the quadratus externus. And so in order to test this muscle, we'll have the patient laying supine on the table. We're going to have them actively flex their hip up to 110 degrees. We're going to bring them into full external rotation and then have them bring their tibia parallel to the table. So make sure that we have that active 110 degrees. We got full external rotation of the hip. I'm stabilizing at the knee. I'm going to have the patient resist me trying to pull the hip into internal rotation. When I say go, ready, go, hold, 1, 2. If that quadratus externus test's weak, we'll go ahead and perform the DFMAT. So we'll have the patient turn on their stomach. Again, this is going to be performed on the opposite side just so it's easier to see on the video. So we'll palpate that ischial tuberosity. The ischial spine, we'll find that ischial spine, and we'll palpate those fibers. And then we'll slide to the superior lateral aspect of the greater trochanter to the insertion of that quadratus externus. Obturator externus. Once the defimat has been performed, we'll have the patient flip on their back again. They'll be supine. We'll bring them up into that active 110 degrees of hip flexion, full external rotation, bringing the tibia parallel to the table, and they're going to give me a 10% contraction as I try to pull into internal rotation. Ready, hold. 1, 2, 3, 4, 5, 6. We'll perform 6 of those contractions on each affected side.